Hey, what's up? What's up? Welcome back to another episode of A Needle in a Haystack. I'm Chris White, mucosal melanoma survivor, thriver, advocate, inspirational speaker, and self-published author of Killing Cancer with Tills. Before we get started, real quick disclosure, I am not a medical expert. I am only an expert on my story and my experience. If you need any assistance, please seek out your care team. All right. Real quick here on episode 6. App News, two hands now. Recapping from episode 5. Hello, what's up, and welcome back. Just to do a quick recap from the last episode. On August 6th, 2018, down at MD Anderson, had my initial consultation with the surgeon. They ordered additional tests to get a full picture of what would be going on in the abdominal area, MRI, CT scan, and ultrasound. Those are scheduled for August 6th and August 7th. Also scheduled an appointment with the GI colorectal surgical oncologist to have a sigmoscopy done, and that was scheduled for August 7th, 2018. On August 7th, 2018, the ultrasound was performed that morning. Then the appointment with the sigmoscopy. There was some pigmented mucosal that was found and was not able to be biopsied. So a colonoscopy was scheduled with a biopsy for that Friday on August 10th, 2018. The initial consultation with the radiology oncology department was on the 7th of August as well. Radiation would be 6 weeks after the most recent surgery and would be a total of 5 doses in 2.5 weeks. Monday and Thursday or Tuesday and Friday. The treatments are 45 minutes long. The initial appointment prior to create a mold or consistent targeted therapy. Radiation will be targeted to anal canal where tumors started. Side effects may be more prevalent after the second week. Recommendations for sperm banking. Okay, so that brings us up to date to August 8th, 2018. Here are some of the notes that were recorded from my family. August 8th, 2018, had an appointment with the main mucosal melanoma specialist to review the treatment plan, which would include surgery, radiation, chemotherapy, and immunotherapy. The MRI and the CT scan along with the ultrasound, are free of visible disease, which he was pleased to see, so radiation or chemo is not needed prior to surgery, is not warranted. Chemo and immunotherapy are more of an insurance policy to make sure it doesn't come back. Seeing the surgeon again on Friday, August 10th, 2018, for more details regarding the surgery, and won't see the mucosal melanoma specialist again until after radiation. We will have a colonoscopy done on August 10th, 2018. On the 9th, I prepped for the colonoscopy / biopsy. And on the August 10th, I had an appointment with the surgeon again to go over the details of the groin dissection surgery I will be doing. The surgery date depends on findings from pathology report, from biopsy, from the colonoscopy that afternoon. If additional rectal surgery is required, it would be performed under the same anesthesia. Will require 1 to 2 day stay in the hospital and will need to be down in Houston for a minimum of 1 week for post-surgery follow-up. This will be a significant surgery with a 6 to 8 week recovery. It may be possible to return to work on light duty after 4 weeks. The colonoscopy with biopsy was performed at 3 p.m. and a few polyps were removed. The pathology came in on August 14th, and it was noted here in our notes that on August 17th, 2018, the pathology report for the biopsy did confirm melanoma. We will need to remove the same time as the groin dissection. Surgery is scheduled for August 30th, 2018, and one surgeon will perform both surgeries. So August 9th, 2018, I did the prep for the colonoscopy on August 10th, 2018. The colonoscopy started at 5:29 p.m. and was completed at 5:59 p.m., a total of 30 minutes. These are the results from the colonoscopy. Post-procedure diagnosis. The examined portion of the ileum was normal. One 6-millimeter polyp in the ascending colon removed with a cold snare, resected and retrieved. One 3-millimeter polyp at the rectosigmoid colon was removed with a cold snare, resected and retrieved. 4 2 to 3 millimeter polyps in the rectum removed with a cold biopsy forceps, resected and retrieved. Scar in the distal rectum, biopsy. 2 pigmented areas just proximal to end of surgical site scar in distal most rectum at 3 o'clock position in right rectum. So in the very beginning of the week on August 6th, my first appointment was with surgical oncology. It was after I met with him. I did all my series of tests, scans, and met with the other members of the multidisciplinary team. Right before my colonoscopy on Friday, August 10th, 2018, I met with that same doctor again to kind of recap and go over what some of the plans were. These are some of the notes that were taken by my mom. Plan A was for the first week of September to have surgery, but that would depend on the pathology from the colonoscopy later that afternoon. If any additional surgery was needed, it would be done at the same time. It's expected to have 2 to 4 weeks of fluid drains out of my stomach, 6 to 8 weeks of a total recovery. They would want to see me 1 week after surgery. I would have a large incision. There would be 2 drains specifically coming out of my abdomen. They would let me know in regards to how long I would be expected to be off of work, but estimated somewhere around a month minimum. I will need to elevate to reduce swelling. Also, definitely needed to look into both short-term and long-term disability. I did have both that I paid through my paycheck with my employer. Some of the notes that we have in here state that I must have 14 days consistently out before benefits would start. I will need a medical certification forms from the insurance company. And also, long-term disability doesn't happen until there's 90 days of a waiting period. And at that point, you would get 60% of the pay. But short-term disability was that I would need going in and out of the different treatments. August 30th, 2018. These are the notes from my surgery that my mom had made. Groin dissection and rectal recision. Radioactive dye injected at the source site in the rectum to determine the path of travel in Chris's system. Right and left groin show up. During surgery, 19 lymph nodes were removed from the right groin, 4 of which tested positive for melanoma. An additional lymph node in the left groin was also removed and was diseased as well. Follow-up abdominal ultrasounds will be added to Chris's plan as he goes through treatment to watch this area closely. Doctor was confident that the disease is all out now, including the one spot in his rectum. It was excised with clear margins. Chris was hospitalized from August 30th to September 2nd, 2018. He has 2 drainage tubes in his right groin that will be removed once the output in each is less than 30 cc's for 2 consecutive days. Post-op appointment and follow-up, the doctor is scheduled for September 19th, 2018. Tubes will be removed if they meet the requirement. He will also see the radiologist to discuss treatment. Appointment with the radiology simulation is scheduled for October 1st, 2018. From the findings on the report, these are some of the images as seen in the bilateral inguinal lymph nodes. On the left corresponds to a 1 centimeter node on Series 3, image 66. On the right, this corresponds to a 1 centimeter node on image 60. Questionable faint activity is seen in bilateral external iliac regions with perhaps subtle nodes, for example, on image 53, compatible with secondary drainage. So, for the first week following my surgery, I stayed in Houston until I had my first follow-up. We had a series of notes for that follow-up of questions to ask, so we were curious in regards to a handful of things. Traveled back home to Dallas until I needed to return to Houston to have the tubes removed. The pathology did come back that on my rectum, all disease was excised and margins were clear. In my right groin, they took out 19 lymph nodes, 4 of which were diseased in my right inguinal. In the left groin, they took out 1, which also had disease. At that moment, they had told me that all disease was out. On September 19th, I returned to Houston for my post-op appointment to have my tubes removed from my abdomen. These are the notes. Remove the tubes. Keep clean and change bandage after showering. PT for leg. Continue to exercise to prevent weight gain and lymphedema. Watch the entire leg for swelling. If he gets a cut, wash immediately and watch for infection, red streaks, fevers, chills. The extra antibiotic is for this. Take a photo and call immediately. Eat healthily. Continue Lovenox shots until gone. Juice plus omegas are okay to start back up. We'll watch lymph nodes in groin with ultrasounds over the next 2 years. Most people who have the surgery and radiation in the bottom never have the anal melanoma again. Just have to watch for melanoma in other areas of the body. Keeping Chris on Bactrim antibiotics for another round, and we'll call in another prescription for pain. Forms for returning to work with limits is being filled out by doctor. Then I met with my main specialist for medical oncology on 9/19/2018. 4 weeks after radiation, he can start chemotherapy. We will be administered through IV and can be done in Plano, but we will need to schedule an appointment with his local doctor after radiation is done. CVD chemo drug done 3 to 4 cycles, once every 3 weeks with Keytruda. Make appointment with doctor. We'll see the radiation oncologist and before chemo to do CT scans before chemo starts. Scans can be done after radiation. Need papers for chemo. Scans every 3 to 4 months for the next 3 years after chemo. Brain MRI once a year, then every 6 months, then 8 months through year 5. Chemo, 3 to 4 cycles, once every 3 weeks, 3 to 4 days that week. So week 0, week 3, 6, 9. Keytruda is once every 3 weeks for a full year. Starts with chemo and then continues. Combination of chemo and Keytruda should not be an issue, but it adds time. We'll switch to Opdivo if Keytruda is not approved. Liver function tests from previous tests have normalized. See the doctor after radiation is done. We'll need at least 3 weeks between radiation and chemo. Just a quick reminder, these are the notes that we took at the time, assuming that everything was going as planned. So prior to meeting with surgical oncology and medical oncology appointments to have my tubes removed, my mother and I had sat down and wrote down at least a dozen notes or so for the surgical oncologist and at least a half a dozen or more notes of questions that we had for my medical oncologist. I highly recommend definitely using pen and paper as well as audio recordings, but to keep the best records that you possibly can so you can be able to reference anything and everything without doubt. On October 1st, 2018, I returned to meet with the radiation oncologist to have a consultation about what to expect for the upcoming radiation treatment. These are the notes we took. Side effects could include sense of urgency. If you can work, continue to. It will be good for you and will keep your mind off any pain you may have. Use the step bar on your truck to get in and out to prevent sliding on the seat. Shouldn't be limiting. Eat what you normally do. Juice Plus is fine. Treatment time is about an hour, including check-in. Goals of therapy after surgery are to treat the anal canal. Risk of tumor coming back is high if you don't radiate, 50 to 60%, and 5 to 10% with radiation. Systemic therapy is used to treat the rest of the body. Side effects after 2 weeks: fatigue from the radiation itself. Naps are good. Radiation will cause a sunburn in the area. Bowel movement may be uncomfortable, and Chris may need pain meds. May pee a little more than usual. Long-term side effects may include still feeling a sense of urgency. Sperm banking is recommended. Radiation will drop sperm counts for at least a year, and that could be ongoing. Don't try to have children for at least 6 to 12 months. There could be mutations of the sperm for 12 months after radiation, so use contraception. Dr. Fellow is working on my work release for Chris. Chemo could start 3 to 4 weeks after radiation is done. PET scans can light up, so CT images are usually done. 5 treatments will be needed. Mondays and Thursdays, 45 minutes long. We'll see the doctor again towards the end of radiation.
All right, later, bitches.
All right, Chris.